Good evening to you and welcome so much to Oracle Television Network. Thank you for staying tuned since morning until now. We totally appreciate that and we totally love you for that. And also thank you for making sure that we are always here so that you can get the information that you require, you can get that wisdom that you need, and also you can get that one thing. And that one thing is information. That one thing is powerful. That one thing is something that will transform your life and your future completely. And we agree that when we are in this world, but not of this world. And that is why I usually bring in so many experts in different areas so that you can understand your body well. Unajua ulipewa hii mwili ndio uitunze vizuri na uweze kuelewa vitu mbili tatu kuhusiana na mwili wako na ni nini nafaa, or where are you going wrong? Where are you supposed to be changing, or what you're supposed to be doing and you're not doing, or what you're doing right and you're supposed to be doing even much righter. If that is an English, it is in the English, righter. You're supposed to be doing it so much well. So this is the Health Desk. I'm your host Trevilla Lutta. Tuandamani kutoka saa hizi mpaka tamati. And you know the best thing is you keep on commenting, keep on texting, keep on asking the questions. And we are here for you. Today we want to tackle something very great, something that is affecting a lot of people in this world. A lot of people in this world. And I want you to have the basic knowledge about it. But before we start talking about it, I want to welcome my guest of today so that he can introduce himself, tell you where you can find him, and so on and so forth. Karibu sana daktari.
Thank you very much, Trevilla, for this wonderful invite. Once again, I'm grateful for this opportunity to get to enlighten people and get to give people knowledge on how to improve their lives in each and every days of their lives on this world. Yes.
Okay, thank you so much even for honoring the invite. We do not take that for granted. And if you are watching us for the first time, karibu sana. Make sure that you keep on telling other people, keep on sharing the life so that people will get to understand what you're talking about. And if you have a question, feel free to ask the question so that daktari will answer that question that you have. Wache swali kuume, and we have somebody who can answer that very well for you. Today I want to tackle something good, something that imeguza watu wengi sana. Millions of people in this world have been suffering from it, and we want to understand what really it is and what causes it and how can you prevent it. Is there a cure for it? And what am I talking about? We want to talk about COPD. And unajua ujui COPD ni nini? Ndio maana tumeleta daktari hapa tueleze ni nini. Maybe imekuwa kusumbua na haujui, ama you have seen somebody who has it and you didn't know what it is, and now ukujua nini iko required kwako kuweza kusaidia mtu. Unajua sometimes you might think you need to have money to help someone, but you just being there for somebody and taking steps. Unamsaidia tu anataka kwenda hospitali, unamwambia by the way, I know such and such hospital that can help you in this. I know unajua hauna hiyo pesa, lakini ukimpeleka mahali anaweza pata usaidizi, you've helped that person in one way or the other. Daktari, what really is COPD?
Well, COPD is a short form, but it's actually chronic obstructive pulmonary disease. And something chronic is something that it is something that grows for quite some time. It's not something that can be abrupt. So when we talk about chronic obstructive pulmonary disease, is a disease of the lungs. First of all, it involves the lungs. And normally it damages the lungs in that it leads to a patient or a person being unable to use his or her normal lungs normally to breathe. So generally it affects the lungs, and then from there you find that when you try to breathe in and breathe out, as you deliver in oxygen to supply to various organs in your body, you find it difficult. So basically it deals with it affects the lungs.
The lungs.
Yes.
So it's the disease that affects the lungs. And before we dive in completely, how common is it in Kenya?
Well, actually I'd say worldwide. There was a study that was done in 2019 And it has been estimated that it is one among the third leading most diseases that are likely to end the life of a human being.
Wow.
Now, when it comes to Kenya, it's among the top 5 diseases that are really killing people nowadays, because most of the people are exposed to it. But when it comes to a point where you diagnose it, mostly it is diagnosed during the later stages. So during the early stages, you might not know you have the disease, but now the symptoms will always start to show during the end stage.
Yes. And talking about symptoms, what are the main cause of the COPD?
Well, we have the main causes that are on the age that are likely to cause this COPD. And most of them, one is when you are exposed to tobacco. Most people who smoke are likely to encounter this disease. And smoke, it can either be primary or secondary. Primary, it means the person who is smoking. And then secondary, it is those people that are around the person. Those are also likely to be affected by the disease. That is one. Two, people who work in industries that produce a lot of smoke. Those people are also at risk of getting that disease. And then number 3, we also have if somebody has been diagnosed with a disease like asthma, you are also at risk of developing COPD. They are among very many causes, but those are just a few. But to name.
Okay. Yes. So how would somebody get to realize the signs that will show you that I'm suffering from COPD? What are the early signs?
Well, like I said, most of the symptoms, they usually show during the latter stages. During the first stages, you might just think it is a normal flu, and then you go get treatment and then it goes. But now when it reaches a point where you are having those symptoms that are developing gradually, that is when now you will have difficulty in breathing. That is the first sign you will have to encounter. You try to breathe in, you get that you are struggling to get that air. And then number 2, you'll always get to a point where you have frequent coughs that at a point they are accompanied by a tough sputum. That when you try to cough, it can be either colorless, yellow or green or brown in color. Those are some of the signs. And then also you find that at some point when you try to do some activities, you get tired easily. Again, you also can have what we call headaches here and there that are not really directing you to where the problem is. And also chest tightness. You feel that just your chest is so heavy, you try to breathe, but you find that air is so limited to you. Yes.
I have heard you saying that you'll have difficulty in breathing. How would someone differentiate asthma from COPD? Because via asthma, somebody will have difficulty in breathing.
Now, for asthma, mostly you will end up with, when you try to breathe out, you will hear there is you're struggling to breathe out. There is that restriction of air coming out. But when for COPD, that is now the reverse. You're trying to breathe in, but now the air that you are trying to breathe in is so limited, because when we define COPD, we have 2 types. We have emphysema and chronic bronchitis. So when you try to breathe in, that is when you find that the airway, the pipe that delivers oxygen to the lungs, is inflamed. And that inflammation is what causes restriction of air when you try to breathe in, which is different from asthma. Yes.
Also, this will have difficulty having the air breathing in.
Yes.
Okay.
Yes.
So how will you diagnose COPD?
Now, there are various tests that we use to diagnose COPD. One of them, we can use a machine called spirometry, which tests the amount of oxygen that is running into your blood and into your tissues. Then number two, we can also use another machine called pulse oximeter that tends to, it's usually put on a finger, which measures the amount of oxygen that you are able to breathe in and out. We call it saturation. Normally, the normal ranges is between 90 and 100. But when it goes below 90, that is when we can say this person is likely to be developing COPD.
Okay.
And then another test we can use also, we do what we call arterial blood gases. We just confirm the amount of oxygen that is running in your blood.
Okay.
Yes.
And are there like screening tests for high-risk people like smokers?
Normally, the test that we usually do, sometimes we do what we call forgetting the name. Like for TB, we screen the sputum. So when you have COPD, we tend to test for TB because TB and COPD are almost the same. So we rule out first TB before we test you for COPD. And then other tests, we can also do X-rays to confirm how your lungs are behaving. And then at some point, when we want the clear picture, we can do what we call CT scans that are going to give the actual tissue the way they appear in the inside of you, how the tissues are respiring. If there is any part of the lung that is damaged, they will also show that. Yes.
Okay, someone is asking, apart from smoking, what other causes can increase the risk?
Now, there are people who are prone to allergies. When you have allergies, at some point you find that the allergies are stimulated by some what we call the allergens, the stimulators, like let's say strong perfumes, dust, people who work in those industries that produce a lot of smoke, like let's say the timber processors. You find that when those fumes they enter into your airway, they go and overstimulate the cells that produce defense mechanisms from your body, and by stimulating those cells, they produce a lot of allergens. When you are exposed to that for a long time, you find that at some point your lungs will reach a point where they'll say, now this is too much, we cannot handle this. And then another cause, you find that people who, like, let me use Kiswahili name ushago. Ushago, we find that most people like cooking with firewood, and with enclosed rooms that are not well ventilated. So at some point when you are exposed to too much smoke of that kind, that smoke you usually inhale, it usually damages also the lungs to a point that you are at risk of developing COPD.
And somebody is concerned about the perfume. So strong perfumes are risky.
They are not risky, but they exacerbate, they increase chances of you developing COPD. Because COPD is anything that is going to lead to the other. Yes, so it doesn't directly lead to that, but indirectly it can lead you to that.
Also, that it's not necessarily that
not necessarily it will cause that, but there are risks that are going to lead you to that, especially if you have another disease that is an underlying disease that you are currently managing.
Okay. Yes. And maybe what are the lifestyle changes that somebody can help to prevent this COPD? Because we've heard that if you use firewood, it is not necessarily that it will give you, but it can lead. If you are around smokers, maybe the place that you're living, there are a lot of people who are smoking. And so what lifestyle changes can help you prevent you getting COPD?
Yes. Now, for such a cases, like let's say if you are using firewood to cook, it is always advisable you cook in an environment which is well ventilated, good room air that is circulating within the room. And then another one is for active smokers and passive smokers, you need to try and avoid sitting close to those people because, like I said, passive smokers, they are more likely to develop the disease more than even the active
one.
yes, smokers.
Why
So
is that?
it's because now you're breathing in the air direct. But this person, remember, he's just taking in the smoke and then pushing it out. But for active smokers, you're breathing the normal air, like the one that we are breathing. So you pull in all that. And then the moment you pull in all that, you will remember now the period to which you are exposed to those people. Gradually, you are going to develop that disease. Like in most cases, you find that somebody has smoked for 20 years, but has not developed the disease. But now this person who is seated next to him, you'll find that even within 1 year span, you're already showing signs of the disease. Yes.
Wow. So that is one somebody should avoid.
Just avoid those crowdings, those areas that are susceptible to that too much smoke. These persons that are active smokers. And then for dusty areas, also try to avoid those areas. You'll be in a better position.
And is it curable?
COPD is not curable, but it can be managed conservatively to improve the life of that person. So it doesn't have the cure directly, but you can improve the status. The moment you improve the status of that person, you are going to greatly improve the life of this person.
Maybe what are the option or the treatment options available for a person already having COPD?
Now, options are many, like the common ones, or in most cases, you need to be managed near a facility, such that when you get to a facility, depending with the severity, is either now with the severity, it's either mild, moderate, severe, or very severe.
Very severe.
During the stages of mild and moderate, you can be managed within a facility as an outpatient, and you can be given, depending with the symptoms, you can be given antibiotics to clear the infection, because most COPD patients are prone to infections, especially for the lower respiratory tract. Then you can also be given what we call inhalers when you have those episodes where you are not able to breathe in normally. And then to the extreme points where now you need hospitalization, that is when now we can supplement you with oxygen that is going to assist you with the breathing, together with these other medications like the steroids and all that. Yes.
Someone's like, how do inhalers work and why are they important?
Now, inhalers are like what we call, I don't know the English word, the puff that you usually inhale ni kama povu, but not ile povu inaruka juu. So it's just air that has been, actually the word is vapor, that has been manufactured in a way with the drugs that are called bronchodilators. These are the ones that are going to assist you in opening the airway the moment your airway is inflamed. So that the moment they open up the airway, air is now able to flow in and out as it flows through your lungs and as it supplies to other organs of the body. Yes.
So they are very important when you have COPD.
They are very important, yes.
And what role do breathing exercise do? Unajua saa zingine people take things for granted, and physiotherapy play. What roles do they play? Breathing exercise and physiotherapy.
Now, I'll start with the physiotherapy, because the moment you are advised to undergo physiotherapy, you find that at some point, when you have COPD, you tend to assume a certain position whereby you are struggling to breathe. So it is important when you undergo those physiotherapies, the physiotherapist tries to maneuver your muscles and your lung tissues so that your body itself is able to breathe in without any kind of assistance. Because now when you assume that position, it means now you'll remain in that position, and with breathing it will hamper your normal cycles. And then for the other one was
the breathing exercise.
for the breathing exercises, you don't just breathe in normally, because like you find that one has done exercises and then starts breathing faster, ile yenye unajifanyia wewe mwenyewe. But in this case you need to be assisted and shown how to breathe.
Oh, so this breathing
Yes.
exercise is not you doing it?
No, you are supposed to be shown, because the moment you will start breathing faster without any controlled measures, you will also trigger.
So there is a wrong way of breathing?
No, especially for those patients
Okay.
who are having COPD, not the normal patients.
Okay.
Yes, you need to be assisted and shown how to breathe. Like, let's say if you are in the severe stage, you need to be shown how to breathe, like take in shallow breaths gradually, progressively, as you gain the normal breathing. Because you find that most of the time when you pull in a lot of air, that much air can be trapped in, and you'll have too much cough that are likely to interfere with your normal activities. Because at some point you'll start fighting for the limited air that is available. Yes.
And maybe for somebody who has already COPD, are there medicines or medication that they are supposed to be taking consistently?
I'd not say consistently, because you cannot stay on drugs forever. What we just do is to assess you. We see where the need is, and then we introduce medications, as we introduce also other lifestyle changes that are going to assist you, because those drugs also have side effects which you cannot rely on them. I mean, you cannot use those drugs forever. So you need to be taught how to do the exercises yourself, how to practice the breathing, and those medications, how do you utilize them? Yes.
Someone is asking, how can patients manage flare-ups at home? These are people who are living already with COPD.
Flare-ups is just an exacerbation, a trigger. Those are things that are caused by triggers. Like, let's say somebody is sweeping the room or cleaning an area, and then you breathe in those triggers. Those triggers are likely to go and exacerbate, increase the chances of you developing these breathing difficulties. So if you know you are prone to that, it's better you get some assistance that are likely to control that trigger when it arises. And actually, if you don't have some assistance, it's better you get those drugs, that in case you have that trigger, you can be able to use that drug to control the worst situation of the disease process.
Also, the key thing is avoiding the triggers that...
Yes, that is number one. Then utilize medications that are available.
Okay. And maybe what are the common mistakes that people who are living with COPD make, the patients make? Maybe hawajui this is a mistake we are doing, but they are making it.
There are very many mistakes. Like, for example, in my area of practice, I encountered a patient who just assumed, after being diagnosed with the disease, just assumed and went back to smoking. Because, like, for example, when somebody has been diagnosed with COPD and it's as a result of smoke, it's very difficult to tell that person to stop the smoking. So you find that you treat the patient, you discharge the patient to go home, then he goes back to the smoking. The same smoking that led to that COPD. Then another one, you find that people who are maybe diagnosed with asthma that led to that COPD. They also, let me say it in quotes, they don't care about themselves so much. They go to those areas that have those triggers. Again, you find that you are in that situation of where you are struggling for air again.
Yeah, again.
Yeah.
So those are the mistake. If now somebody was diagnosed with COPD because of smoking, so what will be your advice to them? Because most of them think that it was just a thing. When they go back, maybe they go back out of ignorance. Ama kuna mwingine anasema it's just life. What will be your advice to them?
My advice is you are the driver of your body. And when you are driver of your body, like you are the way somebody can drive a vehicle, you're always focusing ahead.
Yeah.
And you might need to avoid any disruptions whatsoever that may arise. So if you know you have the disease, try to avoid those triggers as much as you can. Then number two, if you are a smoker, if you are taking like 2 packets in a day, which is quite on the higher side, it's better you try to reduce.
Wow.
The
There
number
are people who take 2 packets.
Yes, there are people who take 2 packets in a day.
Okay.
Yes, so it's better if you are taking 2, reduce to 1. If you are taking 5 cigarettes in a day, reduce to 3 or even 2. Now you are on the right track of trying to manage COPD.
Wow. And maybe how important is diet and physical activity when it comes to COPD? Because when you see other diseases, you're told this diet is very important, leave this, leave this. How important is diet when it comes to COPD?
Now, for diet, like other diseases, diet is what your body is able to show to the public. So for diet, I'd recommend, now, for example, for COPD, you have your lungs that have been damaged to an extent. So it's better you concentrate on foods that are going to improve what we call tissue regeneration. That tissue regeneration, it involves a good balanced diet involving proteins, vitamins, and a few carbohydrates here and there. Plenty of exercises, like you've mentioned. And these exercises have to be also controlled, because when you do extreme, like I said, we'll have those exacerbations that are going to be triggered.
Maybe how worse is worse when it comes to exercise, because kuna ule ambaye anapenda kufanya exercise. Maybe how far should this person go, and maybe wapi ndo afai kupita?
Now, I'll give you a good example. Like you find that somebody has been diagnosed with the COPD and he used to run.
Yes.
So when this person used to run, it is always advisable you reduce those runs, because at some point when you use your muscles to the extreme, you find that you will get tired easily. And when you get tired easily, it's very easy for this person to have those breathing difficulties and can really slow you down. So when you are used to running, try to reduce those runs. And if you are doing something like short races, it is always important to go to listen to your body. Because you will find that you can make 10 steps and you feel like you're easily going to get those symptoms.
Yeah.
So if you feel like 10 steps is too much for you, just do 5. Yes, by that way you are going to manage your body according to how your body is telling you.
Okay.
Yes.
And maybe what are the danger signs that somebody should be looking at and knowing that this one need urgent hospital care? Because those people who are already living with COPD, they can slightly have an idea. But somebody who is not yet there, or who doesn't know what is happening to their body, what are those danger signs that they should be look at and know that this one needs an urgent hospital care?
Now, the first thing you are supposed to do for hospitalization, when you have extreme struggle for air, like let's say I'm in a room and I'm not able to breathe in normally like other people. That is the first sign you are not supposed to ignore. Yes, because the moment you ignore, now the next step you'll find yourself in a hospital where you don't know where you are. So the first thing you're supposed to do, always listen to your body. And when you start having those struggles for air, that is the first thing you're supposed to do. Be rushed to the hospital. Then another thing, if you have a continuous cough that is not going away, and sometimes it is accompanied by sputum that is colored, let's say green or brown, that is a good indication that your lungs have been extremely damaged. Then number 3, when you have when you maybe there are people who are let me say well off, and you can have a pulse oximeter in your house, and you take your readings and you find that your readings are below 70. That is a good indication you need hospital management. You need to be admitted in a hospital facility and be managed accordingly. Yes.
And maybe can COPD lead to heart condition or other complications?
Yes. COPD can lead to heart conditions, and not only heart conditions, it can also lead to other what we call organ failure in your body. Because you find that the lungs are the organs in your body that know which area needs oxygen and which area needs it more. So the lungs, they supply oxygen to all the organs and all the parts of the body. So you find that when you have limited oxygen, there are those parts that are going to, those organs that are going to be affected most. The first one being the brain, the next one being the heart itself, the heart, and the next one being the kidneys. Because all these organs, they coordinate in terms of how they function and how they give out the output of their work in your body.
Oh, so lung is the master organ?
Yes, it supplies oxygen to all the body organs.
Wow. And maybe you talk to young people, because nowadays people are they are living their lives the way they want. Kuna ile point, you cannot tell me, let me just live my life. How risky is them they are bringing their lungs to the risky part? What should you tell them, these young people? What advice do you have for them so that they know that what they're joking with when it comes to life? Kwa sababu saizi smoking is fun.
Yeah.
So if you want to have fun, you smoke anything. Kuna vitu mingi zimekuwa invented of people smoking, and this is one way of them destroying their bodies. So what will you advise them?
Well, I don't know where to start because advising a young generation is sometimes difficult, but I'll try. The first thing I'll say, take care of your own body, because you know what your body tells you, you know how your body functions, and you have no other body to maintain. It is just yours. The moment it is gone, you are gone forever. And the key thing that I'll advise against smoking, especially for tobacco, marijuana, the bangi, and nowadays I see people who are smoking shisha and all that. All those, that is your life, you are playing with it. So if you don't like your life, it's better you sit down yourself and try to rethink what you are doing to your body. Because the moment you reach to a point where you have COPD, when people walk outside here, you'll always feel like the world is a free world, you can do anything you want. But the moment you put you find yourself in that hospital bedding, that is when you will get to know the reality of what you put yourself in.
That is when the reality hits.
Yes, that is when reality hits. So it's always good, don't follow the masses. Be yourself and take care of yourself, because who knows, they say tutapewa mwili mpya mbinguni.
Tulilisikia wasema haribu hii kwa sababu kuna mwili mpya.
Yes, but the moment you find yourself in that bed, ama in that hospital setting, that is when you'll know, I wish I knew. Could come when you are before you get to that bed.
And maybe what should community, society, families do so that we can reduce these cases of COPD?
Well, the first thing I'd talk about is lifestyle. Let people change their lifestyles, because this freelancing kind of life does not favor many. So it's always good for a family. If you see maybe a parent is smoking, try to talk to him or her. And I know when people see such kind of interviews, by just telling them through the streets or here and there, it's not easy. But the moment you watch such interviews, you get to always get enlightened and know the reality of what is outside here. And by doing that, I think it is easier for people to get to understand some things they can avoid and some things they can know how to live with them. Yes.
So it's just about you having the right information, because
Yes.
I believe some people are not just there, it's because they don't have the right kind of information. Others are misled.
Yes.
Sababu kuna ule ambaye atataka ufanye tu kenye anataka, they will try to pamper it. What I will advise you is get the right information from the right sources, because ukitafuta information kwa the wrong source, definitely you'll have the wrong facts about what is going on. So if you have difficulties in breathing, if you're feeling something is not correct, unajiangalia, unasikia tu my breathing system, something is happening, it's not right. It is good for you to go get checked. It's good for you to go get screening, kwa sababu you might overlook a thing and it ends up blowing up to become a massive problem that ungeweza kuizuia kwa hiyo stage kidogo. Mtu anaweza sema Biblia ilisema love your neighbor as you love yourself. So kuna hii part ya you have to know how to love yourself first. And you knowing how to love yourself is by you going to get checked, understanding how is my body working? Is every organ functioning the way it's supposed to be functioning? Mbona nimekuwa nikisikia hivi na hivi? Why am I having this difficulty in breathing? Why am I feeling pain in this area? Just go, get checked. Na tulikubaliana ukifika pale, hata ile information yenye unaona si important, wewe ipeane tu. Unasema nilipumua. Kuna swali nimeona hapa akiuliza, anapumua kidogo, anasikia ni kama ni ngumu kidogo, anarudi tena. Is that daktari usicheke. Is that a problem? Juu anapumua kidogo, anasikia ni kama hewa inakwama kidogo. Anasema anapumua in pulses. Is that a sign? Anafaa kuenda kwa hospitali?
Kupumua, breathing in phases, shallow, that is not a direct diagnosis of COPD.
Okay.
It must be accompanied by other symptoms. So singularly doesn't necessarily mean you have COPD. It can mean you have something else.
So apumue.
Pumua tu kawaida.
Don't worry, usishtuke, lakini tujakwambia tu usikose kuenda kuona daktari, but tumambua is not an alarming thing. So you just breathe. Maybe as we are ending, daktari, what will be your final message to families who are having people who are having COPD? Because you know sometimes somebody might have the COPD, but the surrounding that the people have, hiyo ni ile kuvuta yako ndio ilikufanya upate umia peke yako. What will be your message to families or people living with patients who have COPD?
The message that I'll have for them is welcome them, welcome those patients in your setting, within the family setting, and embrace them, because they are normal people who are living their lives normally before they encountered COPD. And by embracing them, try to take good care of them and also secure their environments, and also give them good encouragement, because COPD is not the end of life. Give them encouragement, because most these people, they need our support, because the moment you are diagnosed with whichever disease,
Yeah.
you always need your family or caregiver support that is going to assist you in your recovery. And then also provide for them good nutrition that is going to assist them during their recovery.
Okay, maybe the last question, where can our viewers get help or screening? Are there specific hospitals that is specialized only for that, or any other hospital can do that?
There might be, but you don't need to go to those specialized areas.
Okay.
Just walk in within any facility, and there are those signs we call the cardinal signs. You don't need to wait to go to a special facility. There are those cardinal signs that when we find such a patient, we just by just asking them a few questions here and there, before you do the other confirmatory tests, you are able to diagnose this patient and know if he is suffering from either asthma or COPD or any other condition.
When you're saying cardinal signs, what do you mean?
Sorry to use a medical term. Cardinal signs, they are the first quick signs that a patient is likely to present with. Yes.
Okay. So you've understand any hospital can do that. It's not a must for you to uvunjike mgongo. Kama venye Waswahili wanasemanga uvunjike mgongo ndo ufike pale. No, just go, get help, and give every information. Even that one that you feel for you, it is not important, just give it to the doctor. It's very, very important. Tuliambiwa unaweza sema ulikohoa mara 3 na umekuwa ukohoa miezi 3. There's a different. So for you to be diagnosed well, give the correct information. Sema nimekuwa nikikohoa for the past 3 months. So they will give you the correct, because if you say 3 days, they will not diagnose you with what maybe you are suffering with. So just give that information and it will help very well, and it will carry a long way. Itakubeba ile kitu nyingelipuka pale mbele utaweza kuizuia. Daktari, give us your parting shot as we are ending.
I'd like to say thank you for this interview. And if you have any questions, feel free to ask. If you have any what we call you're not sure with some of these things, get to reach out to us. We can always be available to assist where you need those help. Yes.
Okay, thank you so much for honoring our visit and our invitation. We really, really appreciate and would not take that for granted. And I hope you at home, you've learned something. And those who have asked the question, I hope you umepata ile jibu ambayo ulikuwa unataka, unatarajia. Na kama bado uko na maswali, please keep them coming, and we'll make sure that Daktari will come here again and also answer your questions. Remember also, you can become a partner with Oracle TV. It's very simple. It's very easy. Just go to your pay bill number 171133. Account number is Oracle TV, and you partner with us according to how God has blessed you. We usually come on air because of your love, because of your massive love, because of you supporting us every single day, because of that massive and the immense love that you've shown us. Tumekuja on air, people's life are changing. Right now you're getting information that hungepata mahali popote. Is because of your support, and we totally appreciate. The pay bill is running on your screen. And also, if you want to partner in so many other ways, it is very simple. You can call us on 0711 176 006, and we'll be glad, so much glad to tell you how you can partner with us. There is advertisement, there is quizback, there is interviews. Kuna ile ambao unataka tu wewe sasa ukuwe tu hapo uelezee watu, you can also do that. And also kama pia unataka business yako tukuje mahali huko, we will do that for you. Tutakuja mahali huko, we advise you what is good for your business, what will work for your business, and what will take your business to the next level. So just give us a call and will clearly guide you on how to improve your business, because the Bible says it, God who teaches us to make wealth, and that is why we are here. Akisha kufundisha to make wealth, you broadcast your business, you make Kenya know that you're selling that cloth, and you're selling it in a good way, and you're selling it so that the person will look beautiful, will make you know how this person will visualize. Ndule mtu akitaka kuona nguo yako anajua hii nguo itanitoa hivi, nikinunua hii gari itanipeleka hapa na hapa, and what are the benefits of me having this car and not this one. And that is why we are here for you. So make sure you call us, give us a call, and we'll be glad. And if you want to decide unasema to me, I just want to partner, the pay bill number is running on your screen. And always I will remind you, put a demand on your giving, put a demand on your sacrifice. Usiweke to just do it and say, this is what I want from God. God, I'm doing this because I know in the next coming 20 years my child will be doing media, and I don't want them to struggle. In the next coming 20 years, I want this tender to be mine. And that is the demand you put on your giving. And of course, thank you so much for being together with me kuanzia pale 6 until now. This is the Health Desk with me, Trevilla Lutta. I tell you, this is the direct line to your medical doctor. Until next Friday, same time, same place. God bless you.